Jungle gyms and paving sidewalks. That is just a sampling of the grab bag of projects in the new bill, according to our next guest, and he should know. He's Senator Mike Enzi of Wyoming, and he is the ranking Republican member on the Senate Health Committee, and I might add, the Senate's only accountant, which is an impressive feat. Senator, good morning to you.
Good morning.
All right, so this caught our eye. You sent out this press release saying that in the Kennedy-Dodd bill, this is the Democrats' main bill on health care reform, they're not only looking to pay for health care, which they've already said pretty openly, they don't know how they're going to pay for it yet, but they're also looking to pay, according to you, billions to beautify streets, build new sidewalks, bike paths, and put up street lights, etc.?
Yes, there's a $10 billion provision in the bill to do what they call prevention, which is a lot of pent-up spending. It's actually a mandatory account that would go to whoever runs that part of appropriations that they could then dole out. It's a safer series of earmarks than anything that's ever been imagined before. And that's exactly what it is, a series of earmarks. And they do have a little bit of a pay for in there. They pay for it by cutting out incentives for people to make better choices in their health care. We know that smoking and obesity and other things contribute to health care problems. And people that give incentives to quit smoking, people that give incentives to reduce weight, are going to lose that option in order to be able to fund gyms and community centers and other things that I guess could have something to do with prevention.
Well, what sense does that make? If you're going to take away, you want to incentivize people to lose weight because obesity is a huge cost to taxpayers in this country and to the healthcare system in general. Same thing for smokers, huge cost. So why would you take that money away to pay for jungle gyms? I understand it's important to get the kids active, but that seems like taking away from one good cause to pay for another.
They're shifting a lot of costs in this, and we are hoping that we can have health care at affordable price for every American, and we need to have it paid for. And this is not the way to pay for it. This is an addition to put on there that's just pent-up spending. We have some great opportunities here, but not if we try and extend the system to places that it was never intended to go. If we focus on what we're trying to do, we can have some good solutions. It needs to be through a bipartisan bill, and bipartisan means both sides involved in the drafting of it, not the Kennedy staff just presenting us with an ultimatum that we could take or leave.
Now you mentioned, sir, that this, in your view, is a bunch of earmarks, for the jungle gyms and the sidewalks and the bike paths and the financing of new grocery stores and farmer markets, and I could go on. This is from your press release. But how is it an earmark? Because according to the draft language I saw in the bill, the Secretary of Health and Human Services will act through the directors of the Center for Disease Control, and they will award competitive grants to people who want to build these so-called proven evidence-based community preventative health activities like jungle gyms.
Yes, it's just a mandatory award that will go to the person that does the appropriations for Health and Human Services to be allocated out as earmarks for all of these special projects, these pent-up things that they would have liked to have done that they've never been able to find the money to do. And this is not necessarily offset yet. We haven't even looked at offsets. We haven't looked at how it's going to be paid for. Now, we keep talking about bending the curve on healthcare spending, but that is not where it's going. There are some ways that we can improve healthcare and we can lower the costs, but we can't do it by providing extra projects, street lighting, jungle gyms, all of the other things. There are some good ways of doing prevention, but those are not it.
All right, Senator Enzi, thank you so much for coming on and calling our attention to it. It's a surprising provision in the bill. I guess the rationale is to get the people out there and moving and so on, but understand your concerns on it as well. Senator, all the best to you.
Thank you.
Right about 19 minutes past the hour. Keeping an eye on Wall Street on a Monday. Not looking good, is it?
Whoa.
Off about 158 points. This follows trading